Magtab Senior is a mineral supplement that helps prevent and treat low levels of magnesium in the blood. It can also be used to alleviate symptoms of too much stomach acid, like heartburn and stomach upset. Magnesium plays a crucial role in the normal functioning of cells, nerves, muscles, bones, and the heart. While a balanced diet usually provides enough magnesium, certain situations can cause your body to lose magnesium faster than you can replace it from your diet. These situations include treatment with diuretics, a poor diet, alcoholism, or other medical conditions such as severe diarrhea, vomiting, or poorly controlled diabetes. It is recommended to take Magtab Senior as directed by a healthcare professional, and the optimal timing for taking this supplement may vary depending on your individual needs. When taking Magtab Senior, it's important to follow the directions on the package. It's best to take magnesium supplements with a meal to reduce stomach upset and diarrhea, unless directed otherwise by the product instructions or your doctor. Take each dose with a full glass of water, unless directed otherwise by your doctor. If you're taking the chewable tablets, make sure to chew them thoroughly before swallowing. If you're using a liquid product, be sure to measure the dose carefully with a medication measuring device. Take this medication regularly at the same time each day to get the most benefit from it. The dosage is based on your medical condition and response to treatment, so be sure to follow the instructions on the product package or given by your doctor. If you experience symptoms of low magnesium blood levels, such as muscle cramps, tiredness, irritability, or depression, be sure to tell your doctor. And as always, if you think you may have a serious medical problem, seek medical help right away. If you experience stomach upset or diarrhea when taking Magtab Senior, try taking it with a meal to reduce these effects. If these symptoms persist or worsen, it's important to consult your doctor or pharmacist. Your doctor has determined that the benefits of taking this medication outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While it's rare, a serious allergic reaction to Magtab Senior can occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. As for the best time to take this medication, it is recommended to follow your doctor's instructions. If you have any concerns about the dosage or timing, consult your healthcare provider for personalized advice. Before taking Magtab Senior, make sure to tell your doctor or pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. If you have kidney disease, it's important to consult your doctor or pharmacist before using this product. Some forms of Magtab Senior may contain sugar and/or aspartame, while liquid products may also contain alcohol. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet, make sure to ask your doctor or pharmacist about using this product safely. If you're pregnant, Magtab Senior should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. And if you're breastfeeding, consult your doctor before using this product. It is important to be aware of potential drug interactions with Magtab Senior, as they may change how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Magtab Senior are cellulose sodium phosphate, digoxin, sodium polystyrene sulfonate. It's important to note that magnesium can bind with certain medications, preventing their full absorption. If you are taking a tetracycline-type medication, such as dimeclocycline, doxycycline, minocycline, or tetracycline, be sure to separate the time of the dose from the time of the magnesium supplement dose by at least 2 to 3 hours. If you are taking a bisphosphonate, a thyroid medication, or a quinolone-type antibiotic, ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. Additionally, check the labels on all your prescription and non-prescription/herbal products, such as antacids, laxatives, and vitamins, because they may contain magnesium. Ask your pharmacist about using those products safely. If you or someone else has taken too much Magtab Senior and experiences severe symptoms like passing out or difficulty breathing, it's important to seek emergency help right away by calling 911 or a poison control center. Symptoms of an overdose can include a slow heartbeat, extreme drowsiness, dizziness, confusion, muscle weakness, and loss of consciousness. It's crucial to get immediate medical attention in cases of overdose. When taking Magtab Senior, it's important to have regular medical tests to monitor your magnesium levels and kidney function. Make sure to keep all your medical and lab appointments and consult your doctor for more details. Magnesium supplements come in different forms and strengths, and many are available without a prescription. If you're unsure about which product is best for you, ask your doctor or pharmacist for guidance. In addition to taking the supplement, it's important to maintain a well-balanced diet that includes foods high in magnesium, such as avocados, bananas, beans, whole grain cereals, green vegetables, and nuts. It's recommended to take Magtab Senior as directed by your doctor, and it's best to take it with a meal to help with absorption. Remember to follow your doctor's instructions for the daily dosage and the optimal timing for taking the medication. If you happen to forget to take a dose of Magtab Senior, just take it as soon as you remember. But if it's almost time for your next dose, it's okay to skip the missed one. Just continue with your regular dosing schedule and do not take double the dose to make up for it. It's important to stick to the recommended dosage. It is important to store Magtab Senior at room temperature, away from light and moisture. Be sure to keep it out of reach of children and pets. Do not dispose of the medication by flushing it down the toilet or pouring it into a drain, unless specifically instructed to do so. When Magtab Senior is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.